guys, it's your girl Nurse Doris. Please come. We're about to have an obonge topic. Good morning, good afternoon, good evening, depending on your location and where you're watching me from. Please try and subscribe to my YouTube channel. To my returning subscribers, thank you so much. Today we are having an important topic: pregnancy-induced hypertension, PIH. Okay, please, this is really for, most importantly, for pregnant women. And if you're a man watching, please hear it and tell your wife. Okay, and people who are aspiring to be pregnant tomorrow. Pregnancy-induced hypertension is a hypertension that occurs after 20 weeks of gestation in a woman that has a normal blood pressure before pregnancy. Okay, and this pregnancy-induced hypertension, it goes away within 12 weeks of postpartum. That's after delivery, 12 weeks postpartum, in a woman that's the pregnancy developed when the woman was pregnant during that 5 weeks, that 5 months, because that's when they start checking that type, that the pregnancy induced hypertension. That is, they will do, as in, if you go for checkup, maybe antenatal, normally before the 5 weeks, 5 months, sorry, they will still be checking your your blood pressure. But from that 5 months is when they identify this pregnancy induced hypertension. Now that you're pregnant, if your hypertension is above 140 over 80. Okay, if your hypertension is above 140 over 80, please, it's not good at all. It's not good at all. And I encourage all pregnant women to have this digital monitoring monitoring machine for monitoring high blood pressure, okay, at home. It's very important. Or if you can use the manual, the sphygmomanometer, okay, you can use it, and the stethoscope, you can use it to check your blood pressure. A pregnant woman is very important for you and your baby. Then there are the cause of this hypertension. Now, what is the cause? Some people say, what is the cause? Nurse, what is the cause? What is the cause? Midwife, what is the cause? The cause is unknown. Is idiopathic. The cause is idiopathic, is unknown. Okay, is unknown. They are still trying out science. They are still trying out to know the cause, but it's unknown. They can relate it to the pregnancy hormones and the growing fetus in utero. Okay, so but there are risk factors that can predispose a pregnant woman to have this hypertension, okay, during pregnancy. One is if the woman has pre-existing hypertension, okay, before pregnancy, or if a woman with family history of hypertension, the woman can have it. Or if the woman is having renal or kidney problem, the woman can have it. Or if a woman is overweight during pregnancy, he or she overweight, 25 body mass index is high, 25, from 25 and above or greater, the woman can have pregnancy-induced hypertension. These are risk factors. Who is at risk of having this hypertension? A woman whose body mass index the body mass index is this 25 and greater can have it. Is a woman who is at risk. Okay, or the woman has in previous pregnancies, the woman had hypertension in previous pregnancies, or the woman have had preeclampsia before in previous pregnancy. That's preeclampsia is high blood pressure that is high over 140 over 80, that is like from 160 above, okay, with protein in urine. Protein in urine is a risk in pregnancy. Okay, it's a high risk in pregnancy. Or if the woman has history of renal or kidney problem, have cardiac diseases, okay, or diabetes during pregnancy. So there are these people now, this group of people now, they are at risk of having this pregnancy, of having this hypertension in pregnancy. Then there are symptoms of high blood pressure in pregnancy. One is constant headache. If you're having constant headache, please just don't hesitate, run to your doctor, okay? Don't hesitate in any way. Run to your doctor or run to your midwife and tell your obstetrician or gynecology. That's why it's good to register in a good hospital if you are pregnant, okay, where they have a good gynecology or obstetrician or your midwife. Okay, just run to the person and tell the person if you're having constant headache, if you're having abdominal pain, if you're having nausea and vomiting. Apart from the first trimester, you are still vomiting, and it could be a sign. Okay, if you're having shortness of breath, changes in your vision, that's you're having a blood vision, swelling in your hands and feet, apart from the third trimester normal swelling. If you're having fluffy face and all these things, it could be a sign of high blood pressure in pregnancy. If you're having low or no urine, it could be that's this renal problem. If you hear me mention renal problem before, okay. There are classification of high blood pressure and classification of this pregnancy induced hypertension. They have chronic hypertension, preeclampsia, eclampsia superimposed or chronic hypertension, okay. They are classified next time we treat the classifications, okay. Then there are foods, as a pregnant, there are foods that can help you, okay, to lower, that you can eat always to lower your this pregnancy induced hypertension. If you already have your hypertension in pregnancy, there are food to eat, because this hypertension in pregnancy could harm you or your baby, okay, if depending on the severity. So there are foods, fresh fruits and vegetables. You inculcate or garnish your food with fresh fruits and vegetables is a very good, it's a very good idea, okay. Then take foods high in potassium like banana, avocados during pregnancy, okay. Apples, juices, you can make your own juices at home. Vegetables, dairy products like milk, like cheese, like yogurt, you take them during pregnancy. Fish, meat. Then you reduce your sodium intake, your salt intake, please, or or either you reduce it or you avoid it at all during the 9 months of pregnancy. It's very compulsory, very necessary. Then there are home remedies to control your high blood sugar at home. One, you have to buy this blood sugar check, blood hypertension check, as in this digital blood hypertension check machine for checking BP, okay, at home. Then reduce your salt intake, your sodium intake, because it's one of the things, the things you should reduce, okay, to help you in this if you're pregnant, you reduce it, or you avoid salt entirely. Just take the challenge in this 9 months. 9 months is a short time, is a long time, okay. Just take the challenge. After, you can start eating your normal food. Then exercise regularly. You can go on night, evening workout, morning workout. 30 minutes to 1 hour workout is okay, okay. It can help to reduce your blood pressure. Then eating a healthy diet, limiting the intake of alcohol, limiting your alcohol intake, limiting your caffeine. If you used to take like 2 or 3 cups of caffeine a day, you can limit it to only 1, okay. Then fetal alcohol, taking alcohol during pregnancy can cause fetal alcoholic syndrome, which is not good if you are pregnant. Then another thing is don't smoke. You should not smoke during pregnancy. Avoid smoking during pregnancy. After pregnancy, you can put up with your normal life, okay. Then monitor your blood sugar check, maybe every 2 days, every day, once in a day is okay, every 2 days is okay. You have to bring out time, okay, to check it, because it's a risk. The people that have pregnancy induced hypertension, they classify as high risk pregnancy mothers, okay. So it's very necessary. Then there are signs of preeclampsia. Preeclampsia here now is one of the classification of pregnancy. Pregnancy induced hypertension is one of the classification, and I just brought it out for us just to know, because if your BP is high, you're likely, if it's continuously high all the time, you're likely to get preeclampsia, and it's not good during pregnancy. From preeclampsia, if it's not controlled or if it's not well managed, it can enter eclampsia, which is you'll be fitting during pregnancy, okay, and it's very, very risky for you and your baby. So there are signs of preeclampsia here: high blood pressure with or without protein in urine, okay. That's why you need to go for your routine antenatal checkup, okay. It's very necessary, because there are some minor tests they run, especially this to detect protein in urine, sugar in urine. Is very, very necessary and important. Headache that does not go away, okay. Changes in vision, you might be having blood vision, flashes of light, you'll not be seeing well, okay, or flashing of light in your eyes. Then nausea and vomiting, dizziness, do as if you want to stagger, okay. If you notice these signs, please don't hesitate. Run to your obstetrician, your gynecologist, your midwife, okay. Just try. Then there are complications if you're having all these things. If you're having pregnancy induced hypertension, there are complications you have as an individual: low birth weight, your baby will be weighing 1 point or even less than 1 point. Premature delivery, stillbirth, that the baby will die in the womb. It's because when the hypertension, when the woman is having hypertension, okay, it will go and block the arteries, it will go and block the flow of blood to the from the mother to the baby, like thereby making the pathway where the blood flow goes or travels to supply the baby in utero through the placenta and through the placenta, it will go and constrict the blood vessels, okay. There won't be normal passage of fluid, electrolytes, blood to the baby, thereby causing baby to die in the womb. So very soon, maybe I can, maybe next time we can teach a pathophysiology, okay. So this is really a high risk. Then induction, labor induction before your baby is full term. The doctor might decide to induce you because of the case, because you might not be able to carry the baby till 9 months. You might likely to be induced before time. Then there are treatment where the woman, if you go to hospital, if you're having this pregnancy, that hypertension, and your doctor have seen that is a no, you cannot keep managing it like that without drugs. The doctor might prescribe nifedipine tablets, might prescribe this labetalol, might prescribe hydralazine, okay. Then if you are not able to control the hypertension, maybe it has entered preeclampsia, then to eclampsia there is a drug too, magnesium sulfate, okay. Magnesium sulfate, they give it on the two buttocks for the pregnant woman, because that one has already entered fit. The woman be fitting during pregnancy, and it's very, very harmful for the mother and the baby, okay. Okay guys, next time we'll be treating diabetes in pregnancy, okay. Then yeah, we'll be treating diabetes in pregnancy, and if you have other topics you want us to talk about, I'll keep bringing up topics. Even midwifery topics, nursing topics, okay, because I am a nurse, I am a midwife. So all those topics and the things related to them, I will keep bringing them, okay, and we'll be learning together. If you have a question you ask, if you have where you need to add up to my own teaching, you can add up, because nobody's an island of knowledge. We are all here to learn. Okay guys, I've come to the end of this video. Thank you so much. Please just try and subscribe to my YouTube channel. Thank you. Bye bye. God bless you.